Have you ever wondered what influences the risk of Down syndrome in a baby and if there are ways to reduce it? Let's dive into it. Down syndrome, also known as trisomy 21, is a genetic disorder that happens when there's an extra copy of chromosome 21. This typically results in developmental delays and distinct facial features. One of the primary risk factors is advanced maternal age. As women age, especially after 35, the risk of having a child with Down syndrome increases. By the time a woman is in her 40s, her risk is significantly higher than a woman in her 20s. This is due to a higher likelihood of errors during the formation of eggs as women age. Additionally, Down syndrome is characterized by an extra copy of chromosome 21, leading to developmental and intellectual disabilities. So, a mother's age and certain genomic abnormalities contribute to the risk of Down syndrome. But what about the specific genetic variations? Down syndrome can occur due to three main genetic variations. First up is trisomy 21. This is the most common form of Down syndrome, and it happens when there's an extra copy of chromosome 21 in every cell of the body. This surplus chromosome disrupts the standard genetic balance, resulting in the characteristic features of the syndrome. Next, we have mosaic Down syndrome. This is a bit different. Not every cell contains the extra chromosome 21. Instead, only some of them do. This variation happens due to errors during cell division after fertilization. Interestingly, because not all cells are affected, the symptoms can be milder compared to full trisomy 21. Lastly, there's translocation. In this scenario, a piece of chromosome 21 gets attached or translocated to another chromosome. It's like a piece of the genetic puzzle ending up in the wrong place. This can result in the development of Down syndrome, even though there are still just two copies of chromosome 21 in the cells. In essence, all three genetic variations result in extra genetic material from chromosome 21, which disrupts the normal function and development of cells, leading to the features we associate with Down syndrome. These genetic variations can lead to Down syndrome. But what medical factors can increase the risk? And are there any prevention strategies? Certain medical conditions and family history can increase the risk of Down syndrome, but there are also ways to reduce the risk. Firstly, let's talk about the medical risk factors. If you or your partner has a child with Down syndrome, or if there's a family history of the condition, your risk is slightly increased. Furthermore, certain medical conditions in the mother, such as poorly controlled diabetes or obesity, can also increase the risk of having a child with Down syndrome. Now, let's shift our focus to prevention strategies. Even though there's no surefire way to prevent Down syndrome, there are steps that can be taken to reduce the risk and ensure a healthy pregnancy. One such strategy is taking prenatal vitamins with folic acid. Taking these before and during pregnancy can help reduce the risk of neural tube defects, which are birth defects of the brain and spine. It's important to note, though, that while folic acid can help prevent certain birth defects, it does not prevent Down syndrome. Another valuable strategy is prenatal screening. Throughout pregnancy, women can undergo various screening tests to assess the risk of having a child with Down syndrome. These tests include non-invasive methods such as ultrasound, maternal serum screening, and cell-free DNA testing, or cfDNA. This last one is particularly fascinating as it analyzes fetal DNA in the mother's blood to determine the likelihood of Down syndrome. If these prenatal screenings indicate an increased risk of Down syndrome, diagnostic tests such as chorionic villus sampling, or CVS, and amniocentesis can be performed to confirm the diagnosis. These tests analyze fetal cells, or DNA, to detect chromosomal abnormalities, providing a more definitive answer. The key takeaway here is that knowledge is power. Understanding the risk factors and prevention strategies for Down syndrome can help you make informed decisions about your pregnancy. While we cannot completely prevent Down syndrome, understanding these factors and taking steps to reduce risk can help expecting parents make informed decisions about their pregnancy. Another essential aspect in mitigating the risk of Down syndrome is preconception counseling and maintaining a healthy lifestyle. If you are of advanced maternal age or have a family history of genetic disorders, preconception counseling could be highly beneficial. This service provides a platform to discuss risk factors, genetic options, and potential interventions that can help minimize the risk of chromosomal abnormalities during pregnancy. It's an opportunity to ask questions, clarify doubts, and gain a comprehensive understanding of the genetic implications involved. While preconception counseling doesn't directly prevent Down syndrome, it significantly aids in making informed decisions about your pregnancy and health. Let's now talk about lifestyle factors. Maintaining a healthy lifestyle before and during pregnancy can promote overall maternal and fetal health. This includes proper nutrition, regular exercise, avoiding harmful substances like alcohol and tobacco, and managing chronic health conditions effectively. A healthy lifestyle not only enhances your well-being, but also an optimal environment for your baby's development. Remember, every step taken towards a healthier lifestyle is a step towards minimizing the risk of complications during pregnancy. While these steps do not directly prevent Down syndrome, they certainly contribute to the overall health of both the mother and the baby, which can indirectly the risk. As always, consult with your healthcare provider before making any significant changes to your lifestyle or health routines. The journey to parenthood is a shared responsibility, and every step you take towards a healthier life is a step towards a healthier future for your child. Please subscribe now to join our community. Give us a thumbs up to encourage us bring more interesting, challenging and high-quality videos to everyone. Our channel, Medicine Health 360, has many more videos to bring you the crucial and systemic medical and health knowledge with a simple approach for better health and a better life. We value your feedback, so don't forget to share your thoughts in the comments below.